The objective of the labor inspection is to further strengthen the implementation of the visitorial and enforcement powers under the Labor Code as renumbered, towards securing a higher level of compliance with labor laws and standards and ensuring continuity and sustainability of compliance at workplaces. For this purpose, the Department of Labor and Employment delegates this function to the regional offices, with the issuance of a list of labor inspectors who are given the authority of conduct inspection, which covers all private establishments, including their branches and workplaces in the regions. The regional offices enforce labor laws and social legislation through the conduct of labor inspection, occupational safety and health investigation, and technical and advisory visit. Special inspections may be conducted as may be deemed necessary. With the provision for mobile devices and gadgets, the DOLE developed an inspection management information system. An important feature of the system is data capture and transmittal from the field in real time, as an electronic checklist is filled up through the use of mobile devices and gadgets. Data are instantly available for viewing and processing to generate reports, statistics, and summons, including real-time monitoring of decent work indicators based on the country's decent work profile. The TAV, or Technical and Advisory Visit, aims to provide assistance to the micro-establishments, or establishments that have 1 to 9 employees, to be sustainable, productive, and competitive. It also aims to transition our micro-establishments to the formal economy that is profitable, while also complying with our labor laws and occupational safety and health standards. There are different ways or modalities to avail TAB. First is the online method. Establishments can enroll in the self-paced technical and advisory modules through our learning management system. For establishments that opted to go with online, they must accomplish the modules within 1 month from the time they registered. Second is on-site. The DOLE regional, field, and provincial offices conduct on-site or face-to-face orientation for the technical and advisory services, wherein micro-establishments are invited to attend. Third is hybrid setup. Establishments can enroll in on-site sessions and attend virtual meetings or webinars using various online platforms like MS Teams, Viber, Skype, Zoom, or Google Meet.
Establishment owners carry a big responsibility to comply with labor laws, including submitting reports and providing documents like payroll records during inspections. But the manual filing process is a major challenge. They need to spend time, money, and effort to fill out forms and deliver them to the DOLE office, often dealing with traffic and delays. Sometimes, there's a long wait just to confirm if the report is accurate and complete. And it's not just employers facing difficulties. DOLE employees also struggle with limited manpower and the time-consuming task of reviewing and processing these reports. The time has come for change. What's required now is a more innovative, streamlined, and efficient process for handling compliance reports. One that will simplify life not just for businesses but also for DOLE employees. Welcome to the DOLE Online Compliance Portal, your all-in-one platform for seamless compliance submissions designed to make compliance easier and more convenient for establishment owners. Telecommuting reports? Flexible work arrangement submissions? Reporting the 13th month pay? No problem. Even work accident or illness reports and the annual establishment report on wages, everything you need is now in one convenient portal. Plus, the DOLE Online Compliance Portal now includes the latest requirement for reporting movie and television shoots under Department Order 246, Series of 2024. All your compliance needs in one place, quick, secure, and hassle-free. With the DOLE Online Compliance Portal, registering your establishment is a breeze. Our automatic registration system ensures you are instantly compliant with OSH Standard Rule 1020. Once submitted, your certificate of registration is immediately available for download, saving you time and effort. If your establishment has been flagged for non-compliance during labor inspection, don't worry. Required documents can be submitted quickly and conveniently. And if you're missing certain policies, like a mental health program or OSH program, we've got you covered with downloadable templates. Submit these documents directly through the portal, where DOLE inspectors will review, provide feedback, and keep you on track for compliance. With admin access on the DOLE Online Compliance Portal, the labor inspectors can easily review the submitted reports and documents from the establishments. If further verification is needed, they can schedule an online meeting through Google Meet, all within the portal. This streamlines compliance checks, saving time and making the process more efficient for everyone. It's a smarter, more efficient way to stay compliant and keep your business running smoothly. Welcome to a new era of compliance, simplified, fast, and effective with the DOLE Online Compliance Portal.
Magandang hapon sa ating lahat and welcome to another episode of Webinar Wednesdays, hatid sa atin ng Department of Labor and Employment, hosted by the Bureau of Working Conditions. I am Jan Barbosa and I will be your host for today's webinar. Alam nyo ba na ang World Hepatitis Day ay ipinagdiriwang tuwing ika-28 ng Hulyo bawat taon, na may layunin na itaas ang kamalayan tungkol sa viral hepatitis. Ito ay ang pamamaga ng atay na nagdudulot ng malubhang sakit sa atay at cancer sa atay. Ang tema para sa taong ito ay Hepatitis, Let's Break It Down, ay isang panawagan para sa agarang aksyon upang alisin ang mga hadlang sa pinansyal, panlipunan at sistemang pangkalusugan, kabilang ang stigma na humahadlang sa pag-aalis ng hepatitis at pagpigil nito. At bilang pakikiisa ng DOLE Bureau of Working Conditions sa 2025 World Hepatitis Day, ang tatalakayin natin ngayong hapon ay ang Building Inclusive and Safe Workplaces amid Hepatitis B concerns. Before we begin our webinar, let us first ask for the guidance and blessing of the Lord.
Heavenly Father, we come before you today with hearts full of gratitude for the opportunity to gather in this webinar. We thank you for the gift of technology that allow us to connect, learn, and grow even from afar. We ask for your guidance and wisdom for every speaker and participant so that we may share valuable and inspiring insights. Help us listen with open minds and hearts, eager to learn from one another. Grant us clarity of thought and expression, making our discussions meaningful and impactful. We pray that this session fosters understanding, collaboration, and the sharing of knowledge that benefits everyone. May your presence be felt in our midst, encouraging a spiritual of unity and respect. We trust in your divine wisdom to lead us through any challenges or difficulties we may face today. As we conclude this time together, may we carry forward the lessons we have learned with a renewed sense of purpose and dedication. In Jesus' name we pray. Amen.
Good afternoon once again and welcome to Season 3, Episode 26 of Webinar Wednesdays. Sa ating mga Facebook Live viewers, huwag kalimutang mag-like, heart, wow or care react sa ating webinar dahil siguradong marami tayong matututunan ngayong hapon. Likewise, don't forget to share this live stream on your Facebook account and use the hashtag Webinar Wednesdays. You may also share this to your colleagues, friends, and families para mas marami tayong magkaroon ng bagong kaalaman. For your questions and inquiries, feel free to use the comment section and rest assured that this will be addressed by our resource speaker after the lecture. We will now proceed to the discussion of our today's topic, which is building inclusive and safe workplaces amid hepatitis B concerns. Our speaker for this afternoon is a graduate of the University of Santo Tomas Faculty of Medicine and Surgery and completed his pediatric residency training at the Hospital of the Infant Jesus. He obtained a Master of Public Health degree as well as a diploma in international health from the University of the Philippines. He is a past national president for 3 terms and presently the chair of the Specialty Board of the Philippine College of Occupational Medicine, Inc., and also he is the incumbent national secretary of the International Commission on Occupational Health Philippines. He is currently the chair of the Department of Preventive and Community Medicine of the St. Luke's Medical Center College of Medicine and the former chair of the Research Ethics Committee of the same institution. Everyone, please welcome Dr. Edmir M. Macabulos. Good afternoon, Doc.
Good afternoon. Magandang hapon po, Ma'am Miss Jan, no? Okay,
Apo.
allow me now to share my slide. Okay, kita po ba yung slide?
Yes po, Doc.
Okay. Sige po. Naririnig po ako, ha?
Yes, Doc. Loud and clear.
Sige, maraming salamat po. First and foremost, I would like to thank the BWC for this invitation and to share some information regarding hepatitis B concern. So the topic that was given to me is building inclusive and safe workplaces amid hepatitis B concerns. According to the World Health Organization, no one should suffer stigma or discrimination because of a health condition. Ending the silence and misinformation around hepatitis B is a matter of human rights and public health. This will be our learning objectives for this session. We will not be discussing the pathophysiology and the management of hepatitis in this session. More so yung mga clinical management as far as hepatitis B is concerned. I have nothing to disclose for this speaking session. So let's now proceed to sa hepatitis B. So what is hepatitis B? Sabi dito, the doctor says you have hepatitis B. So meron man nagsasabi, I'll tell you what the dangerous insect, that hepatitis B. It's very obvious na hindi po ito ang hepatitis B na ating pag-uusapan sa hapon na ito. And sabi ng nagtatanong mo siya, you get hepatitis B, why not hepatitis A? Di ba? Lalo na yung mga magulang minsan pag nagtatanong ng grade sa kanilang mga anak, anak, bakit B lang to, hindi ba dapat A? So pag tinanong na ganyan, nadi-disappoint ka pag hindi letter A. But of course, again, this is not hepatitis B that we're going to talk about this afternoon. So what is really hepatitis B? Um, Hepatitis B is a viral infection that attacks the liver, yung atay, and can cause both acute and chronic diseases. Ang sinasabi sa global numbers, around mga 296 million people are living with chronic hepatitis B worldwide. And as far as the Philippines is concerned, the HBs antigen seroprevalence rate is 16.7%, indicating a significant public health concern. So how is it transmitted? One is blood-to-blood contact, yung pag-share ng needles, transfusion, needle stick injuries, sexual contact, unprotected sex sa mga infected na individual, mother to child, which is transmission during childbirth, which is a vertical transmission, at sa mga contaminated objects, sharing personal items like razors or toothbrushes. Ano ba mga simptomas pagka may hepatitis B? One is for the acute infection, pwedeng fatigue, nausea, loss of appetite. Yung iba naninilaw, may abdominal pain, and for chronic infection, maaari kang walang nararamdaman for years, no? So, at itong pag may chronic infection, these are the people with risk of developing cirrhosis or yung liver or liver cancer. Hepatitis B, as already mentioned, is a major global health problem. Overall, about 304 million people were living with viral hepatitis B and C in the year 2022. Half of the burden of chronic hepatitis B and C infection is among people 30 to 54 years old, and men account for 58% of all cases, and an estimated 12% of the burden is among children, in particular for hepatitis B. Hepatitis B and C, they affect the general population sa maraming riyon sa buong mundo, but also specific populations such as those at higher risk or with history of exposure through unsafe blood supplies, medical injections, and other health procedures. Mga newborns at saka yung children at risk, yung sinabi ko kanina, through vertical or mother-to-child transmission of hepatitis B. And notably, yung sa mga settings na mataas ang kaso ng hepatitis B. Kasama na dito minsan yung mga indigenous populations at yung mga mobile and migrant populations from countries na mataas ang prevalence ng hepatitis B. At ganun din ang mga key populations na mga including those who inject drugs, people in prisons, and other closed settings, no? Sex workers, mga gay persons. Of course, this is based doon sa mga pag-aaral, no? And other men who have sex with men and who may be disproportionately affected in different contexts. Hepatitis B is a viral infection that attacks the liver and can cause both acute and chronic disease, no? As mentioned earlier, the WHO, or the World Health Organization, estimates that about 254 million people were living with chronic hepatitis B infections in 2022, with 1.2 million new infections each year. In the same year, in 2022, hepatitis B resulted in an estimated 1.1 million deaths, and mostly from cirrhosis and hepatocellular carcinoma, which is a primary liver cancer. So, sa mga causes attributed to deaths ng hepatitis B naman in 2019, yung acute hepatitis caused nearly 1% deaths, while 99% were attributed dun sa sinabi natin, yung cirrhosis and liver cancer. So, parang naghati sila, take 49.5%, no? And then most of the 72% acute hepatitis deaths were due to hepatitis B. Hepatitis B and C are the major cause of liver cirrhosis in the Western Pacific region. And yung burden of infection is higher in the Western Pacific region, where about 97 million are chronically infected. In 2022 also, an estimated 61 million people were living with hepatitis B in the Southeast Asia region. The Southeast Asia region accounts for the second largest number of new hepatitis B infections after the African region. And less than 5% of people living with hepatitis B have been diagnosed and received, so less than 5% lang, no? Then according to the Hepatitis B Foundation Institute for Hepatitis and Virus Research, more than 2 billion people worldwide have been infected by hepatitis B virus, and over 1 million die each year. Sa bansa, sa Pilipinas, the World Health Organization reported that about 60% of Filipinos have been infected with hepatitis B virus, while approximately 10% of Filipinos have chronic or active hepatitis B and are virus carriers. So anong ibig sabihin nito? Around 8 to 10 million hepatitis B carriers in the world who might infect more people. So the increasing number of infection is worsened by the hepatitis B carriers that are unaware that they may transfer the disease to family members or colleagues. So yung hindi nila alam na meron sila, pagkatapos hindi rin nila alam dahil nga hindi nila alam na meron silang na carrier sila, maaari silang makapanghawa pa ng mga family members or mga kaibigan or mga kasamahan. So the most recent national study estimated yung HBS0 prevalence to be 16.7%, no? So corresponding to an estimated about 7.3 million chronic hepatitis B adults, no? Multiple studies, no, have shown that the Philippines has a high rate of chronic hepatitis B infection. Now, not only do sa mga sinasabi nating high-risk population, but in the general population as well. At factors underlying the high rate of chronic hepatitis B and its sequela dito sa ating bansa include the inadequate use of vaccination for prevention and the lack of treatment for many. So, hepatitis B infection, as gaya na nabanggit kanina, are major public health problems in the Philippines with an increasing economic and social burden resulting from yung infections sa hepatitis B. There are several factors contributing to the high burden ng hepatitis B infection dito sa ating bansa. And despite being an endemic disease in the country, misconceptions about hepatitis B remains to be a problem. Ano ba mga misconceptions na sinasabi? Yung risk of transmission, lack of awareness sa natural history ng disease, yung mga prevention and screening, paano or the clinical management, yung the risk of developing complication, and ano ang impact sa mga pasyente. So dahil dito, because of this lack of awareness, essentially it affects yung response against hepatitis B. And kadalasan, nagkakaroon ng stigma towards hepatitis B. And because of this, even employment discrimination became a major issue for many Filipino workers and job applicants who are hepatitis B positive and who have been declared unfit for work without appropriate medical evaluation and counseling. And these individuals are otherwise healthy and can be gainfully employed. So, ang DOLE, no, recognized the hepatitis B virus as a workplace concern. So, they issued yung Department Advisory 0510, yung guidelines for the implementation of a workplace policy and program on hepatitis B. So, this is also to put in place yung mga workplace strategy as an important component para malimit ang spread and effects ng hepatitis B as part of the bigger community of Filipinos na nakikipaglaban doon sa hepatitis B epidemic, if you might call it. Now, ang Hepatology Society of the Philippines naman, naglabas ng mga categories of occupations according to the risk of hepatitis B exposure from infected workers. So, kinategorize nila Category 1, Category 2, Category 3. So, this will partly give us an idea who among our workers are high risk in contracting and or transmitting yung hepatitis B. So, pag sinabing Category 1, ang sabi ng Hepatology Society of the Philippines, ito yung mga healthcare workers. So, na nagpe-perform ng mga exposure-prone procedures. And then other workers whose occupation will involve bodily fluids for exchange o potential na magkaroon ng exchange. No? And then category 2, ito yung healthcare workers then, pero they are not performing or who do not have reasonable expectation or of performing exposure-prone procedures. Pag nasa category 2 ka, these are those who have minimal risk of transmission. At pag category 3, ito yung non-healthcare workers na hindi rin nagpe-perform ng exposure-prone procedure or mga occupation na wala sa category 1, wala sa category 2, very, very nil ang tsansa na makahawa o makapag-transmit ng infection. So again, hepatitis B continues to be a major health concern in the Philippines. Because it is transmitted through blood and bodily fluids, hepatitis B is not spread through the usual workplace activities, no? So hindi siya sa mga pang-araw-araw na gawain, unless yung nasabi nga natin yung yung sa category kanina, hindi siya basta-basta na transmit. And the job of most workers does not confer a risk for transmission ng hepatitis B. Kaya lang, there are certain occupations which pose a higher risk of transmission o pagsasali ng hepatitis B ko dahil it involves yung mga exposure to potentially contaminated blood and bodily fluids. This would include yung mga occupations in the healthcare setting and other workers whose occupation involves the potential for exchange of bodily fluids. Now, meron din tayong mga batas or may mga department orders na tumutulong para lalong mapalawig at makagawa tayo ng mga pamamaraan upang makatulong sa pagbawas ng mga kaso, ma-prevent ito at ma-implement ang mga batas na to at saka department order sa ating workplace. No? Siguro, marami nang nakarinig no Republic Act 11058. Ito yun, an act strengthening compliance with the occupational safety and health standards and providing penalties for thereof. No? Meron doon sa covered workplaces, sa part ng occupational safety and health program, sinasabi, covered workplaces shall have a safety and health program. No? So dapat yung mga covered workplaces ng batas na ito, including yung may mga programa sila, safety and health, including or following yung policies, guidelines, transmission. Ito yung mga diseases na sinabi, kasama yung hepatitis B, prevention and control. Tapos, meron din tayong guidelines, no? Governing yung employment and working condition of health personnel in the private healthcare industry. Alam naman natin na mas mataas din ang posibilidad na magkaroon ng transmission as far as the healthcare setting is concerned. Meron din doon sa isang section sa Department Order 182-17 na dapat isama sa mga, basahin ko siya, the employer shall adopt, implement and promote occupational safety and health programs consistent with the provisions ng OSHS and other related laws and issuances to include prevention and control of these diseases, and that again includes yung hepatitis B. Tapos meron din tayo, of course, later on pag-usapan natin paano ba dapat ma-handle ito, especially stigma, discrimination at yung paglalantad ng mga kaso ng hepatitis B. Meron din tayo na yung tinatawag na Data Privacy Act of 2012 which protects, dapat maproteksyon na natin yung mga kaibigan o mga kasama natin, mga kamag-anak natin na maaari o tayo mismo, no, na kung sakasakaling hindi pala rin na magkaroon o nagkaroon ng hepatitis B. And of course, yung binanggit ko kanina, yung Department Advisory number 5, series of 2020, which is the guidelines for the implementation of a workplace policy and program on hepatitis B, no? Currently, many job applicants, meron kung nakita niyo yung zero prevalence natin na HBS antigens, merong mga HBS positive that are declared unfit for work and without appropriate medical evaluation and counseling. At gaya na nabanggit ko na kanina, these individuals are otherwise healthy and can be gainfully employed. And because the workplace is part of the larger community na nakikipaglaban sa mga karamdaman na kasama ang hepatitis B, kinakailangan may mga strategies na ma-implement tayo to reduce the risk of transmission of hepatitis B in the workplace and eliminate yung diskriminasyon against hepatitis B positive workers. Kung babasahin yung DA Sir 510, ito yung mga parts niya, no? At ang sinasabi dito, yung hepatitis B being a major health concern na natatransmit doon sa blood or bodily fluids ay tumataas ang mga ibang yung mga trabaho na malaki ang tsansa na matransmit. Ang pinaka-goal niya is to reduce the risk of transmission in the workplace, eliminate yung discrimination against workers with hepatitis B. Ano? At itong polisiya na to shall apply to all workplaces in the private sector, including their supply chain. Ito ang mga parts, ito mga sinasabi dito sa workplace policy, yung formulation at saka yung implementasyon ng polisiya na ito should be rights-based policy, ano, sa hepatitis B at mandatory siya for all private workplaces. It should involve collaboration between management, workers' representative, and even the government. It may be separate from or integrated into existing OSH policy and programs ng establishmento and shall also be included as provisions of collective bargaining agreements in organized workplaces. No? So, may mga preventive strategies tayo na may mga recommendations as far as the DA is concerned, Department Advisory is concerned. Unang-una, ang mga establishments daw are encouraged to provide hepatitis B immunization, lalong dun sa mga occupations with conceivable risk of hepatitis B transmission sa workplace. Kaya nga nabanggit natin kanina, yung mga healthcare workers, at saka yung mga workers na ang trabaho may involve yung potential for exchange of bodily fluids, hepatitis B vaccination required doon pag mga ganun ang trabaho, And then yung mga measures to improve yung working condition such as provision ng mga adequate hygiene facilities, yung mga containments and proper disposal ng mga contaminated materials dapat na it has to be provided. Tapos yung PPEs, PPEs shall be made available for all workers in high-risk occupation at all times. At yung mga workers should be given proper training and information on adherence doon sa mga standard at saka universal precaution sa mga workplaces. At ang lahat ng healthcare-related establishments at yung mga establishments na ang workers are exposed sa potentially contaminated blood or bodily fluids while the workplace nga shall adhere to sa mga protocols na develop or endorsed by the Department of Health. So, some of the preventive measures na that we can do in the workplace, if you want to offer hepatitis B vaccination to all employees, especially those at risk. Tapos yung training and education, wherein you have to conduct regular training sa hepatitis B transmission and prevention. At kasama dito sa training na ito o yung pagbibigay ng informasyon, yung mga tamang informasyon, hindi yung mga fake news. Of course, we experienced the COVID-19 and then the COVID pandemic or the lockdown. kailangan tamang impormasyon na may bigay natin. Then as far as workplace safety is concerned, if necessary, implement yung mga engineering controls to prevent yung exposure, then provide personal protective equipment. It's not just provision of personal protective equipment, but kung ano yung mga nararapat at siguraduhin din na ginagamit ng ating mga empleyado, ng ating mga workers, yung PPEs na yun. It's not just simply giving them, but ensuring that they are really using yung mga PPEs if necessary nga. Then establish yung mga protocols for handling sharps and other potentially infectious materials. At kung sakasakali sa mga as part of the post-exposure protocols, develop and communicate procedures for employees exposed to potential hepatitis B infection. Minsan kung wala kang mga SOP, wala kang guideline, hindi rin naman alam ng mga workers. I've seen in some healthcare facilities, minsan dahil sa hirap o walang guidelines o di kaya meron guidelines, napakahirap naman sundin, ang daming red tapes, yung mga nagkakaroon ng needle stick injury, hindi na lang sila nagre-report dahil nga unang-una ang hirap sundin ng mga guidelines o di kaya minsan naman dahil sa kakulangan ng kaalaman ng mga iba naman, sasabihin hindi naman siguro ako mahahawa, wag na lang kaya, di ba? So these are there are several parts, there are several component parts ng hepatitis B workplace policy, But one important component dun sa social policy part is no discrimination of any form against workers on the basis of hepatitis B status. Ay dapat walang ganon, So and then another one is individuals or yung workers cannot be declared unfit to work. And then workers cannot be terminated, and management of sick employees should not be different from other illnesses. So ito mga importanteng part ng social policy. So kinakailangan sana ma-implement din naman ito, as part of the yung social policy nga, And then in terms of job, and confidentiality, job applicants and workers shall not be compelled, hindi sila mapupwersa to disclose their hepatitis B status, and other related medical information. Yung co-workers shall not be obliged to reveal any personal information about fellow workers, And then yung access sa mga personal data shall be limited to the personal medical personnel or if in case it's going to be legally required. Then yung mga access to personal data relating dun sa workers' hepatitis B status shall be bound by the rules of confidentiality and shall be strictly limited as earlier mentioned sa mga medical personnel or if kung sakasakali nga it's going to be legally required. Then in terms of work accommodation and arrangement, yung mga employers shall not take measures to reasonably, they should take measures rather to reasonably accommodate yung workers who are hepatitis B positive or with hepatitis B related illnesses. And then through agreements between the management at saka yung sa mga workers representative, yung mga measure to support yung mga workers with hepatitis B are encouraged, maybe through flexible work arrangement, flexible leave arrangement, yung scheduling of working time, arrangement for return to work. And of course, now that we have experienced yung mga work from home arrangement, it could be part doon sa pwede nating maging maisama doon sa ating work accommodation arrangement, So, yun nga, sabi natin, appropriate work arrangement doon sa mga workers with hepatitis B status, So, pwede nating isama yun, Then yung sa mga workplaces, yung sa pagtungkol sa screening, diagnosis, dapat yung mga workplaces shall establish yung referral system and then provide access sa mga diagnostic treatment services para sa mga magagawa, for appropriate medical evaluation monitoring, at saka yung management. And then yung pag-adhere natin sa guideline na ito, lalo na yung mga healthcare workers, doon sa paano pag-evaluate ng hepatitis B positive workers, yun ay ini-encourage ng mabuti, And then yung screening for hepatitis B as a prerequisite for employment shall not be mandatory. Again, screening for hepatitis B as a prerequisite for employment shall not be mandatory. Then, worker who contracts yung mga magkakaroon ng hepatitis B infection in the performance of his or her duty, sana ma-entitle siya ng sickness benefit, no? And shall be given to those who contract hepatitis B at work. Now, syempre, pagdating sa trabaho, may kanya-kanyang responsibilidad yan, ano? On the part of the employer as well as on the part of the workers. So, yung sa employers, no, they should be the one to develop, implement, and monitor and evaluate yung workplace policy and programs, no. Siyempre kasama rin naman ang mga manggagawa diyan. Tapos yung programa should be adequately funded, yung policy at saka programa. Tapos dapat sumusunod to sa mga legislation sa mga guidelines na meron tayo, no. And of course, even the policy at program dapat din nakakascade, alam ng lahat ang tungkol dito. Tapos you have to ensure non-discriminatory practices, and of course gaya na nabanggit kanina yung pag-provide ng PPEs. Ang sinasabi rin dito sa department advisory na to, jointly review policy and program for effectiveness, and of course again ensure ang confidentiality at saka yung access na medical record should be limited only doon sa mga authorized persons, no, or individuals. Now, on the part din ng workers, ganun din, ano, they should really participate doon sa in terms of education and training of members, and they have to practice yung non-discriminatory acts against co-workers, no. So hindi lang naman yung si employer, pati everyone actually in the workplace should ensure na walang magkakaroon ng discrimination. And then they shall, everyone except again yung sinabi natin kanina, pwedeng mag-awak o magtago ng record, but the workers, if they have nothing to do with dun sa data, no, shall not have access to personal data relating doon sa workers hepatitis B status, no. Then similarly, nabanggit ko na kanina, they have to comply with the universal precautions and preventive measures and inform healthcare provider if increases yung sa company physician or OH physician on their regarding of their hepatitis B status, no, if their work activities may increase the risk, no. Now, this is a busy, very busy, very busy slide, no. Pero ang sinasabi lang dito sa slide na to, anong laman ng ano tong data na dito, ito yung number of establishment employing 20 or more workers by occupational safety and health OSH policies programs implemented sa region noong 2021, ano. So pangkalahatan ito, no, yung mga nagagawa ba, na-i-implement pa ng mga kumpanya, no. Base dito sa dokumento na to, merong na check na 33,650, no. At na mataas ang, at least general, as a general, mataas ang sa implementation, although sabi from a previous survey at ito medyo bababa ng konti, but I think it's in the high 90s. Ngayon ang tanong, paano naman in terms of since we're talking about hepatitis B, ano ba ang nagagawa ng mga nag-report o nabisita, na survey na 33,650 na mga establishment? Maganda ba ang pamamalakad nila in terms of addressing also yung tungkol sa hepatitis B? Yung mga nabanggit na natin kanina regarding of course yung may training, may mga programa, may polisiya, non-discriminatory attitude dun sa kumpanya, and so forth and so on. So ngayon, himayin natin yung busy slide na yun. Ano sinasabi ngayon dun sa survey, no? So in terms of policy on non-discrimination of workers confirmed, suspected, perceived to have hepatitis B. Ang compliance is 45.94%. Hindi man lang ho umabot ng 50%. So imagine, 45.94% lang. And then policy and work accommodation for workers with hepatitis B. 42.84%, roughly 43% lang ang compliance natin. Tapos, policy on confidentiality of medical information for workers with hepatitis B. 45%. Ano ibig sabihin? Hindi na, ibig bang sabihin maraming marites sa mga kumpanya. But again, we have been emphasizing yung confidentiality of records, di ba? Then yung programs on advocacy, training, information dissemination for prevention and control hepatitis B infection. So mga programa regarding sa advocacy, sa pagtuturo, pagbibigay ng mga tamang impormasyon, and regarding especially sa prevention and control of hepatitis B, 41%. Parang pababa siya ng pababa, And then programs for hepatitis B prevention and control with the following elements. Yung promotion of immunization for hepatitis B, or roughly 25%, at accessible diagnosis, treatment, and referral mechanism to workers, 26% lamang. So siguro sa mga nandito ngayon, medyo pag-isipan din natin, ano ba pwede natin gawin, marami mga dokumento, sinabi ko may mga legal documents or mga sinasabi, ano ba yung nararapat as far as hepatitis B is concerned. Although of course advisory, it's just an advisory, but there are laws also that states that we should have policies or programs as far as hepatitis B is concerned. Of course, not just hepatitis B, there were mentioned of several diseases. We have several department orders with health domain. So, anong sinasabi, Now, in terms of sa naman, kasi ang Hepatology Society has been helping or has been collaborating with the Philippine College of Occupational Medicine. And of course, sila rin mismo na siguro kaya sila parang narinig ko in some of the members at saka yung very, very active as far as tungkol sa hepatitis B is concerned. And nakikita nga nila yung mga discrimination na nangyayari at saka yung problema nga doon sa mga workplaces. They came out with some policy statements. Isa, a positive hepatitis B surface antigen result should not be a basis to discriminate, restrict, or disqualify a job applicant from being gainfully employed. Ito po ang hepatologists, members po ng Hepatology Society Ito yung mga eksperto pagdating doon sa field na yun. At sila pinakikinggan at nagko-collaborate kami para mapagtulungan ano nararapat gawin. But these are the doctors na espesyalista sa field na ito. At sila rin ang kung sakaling kinakailangan, nalapitan natin kung may mga gusto tayong malaman regarding hepatitis B, especially yung mga management, may mga bago na rin po na pamamaraan at sila yung nakakaalam ng mga bagong pamamaraan in terms of clinical management. Tapos sinasabi, hepatitis B positive applicant should not be declared unfit to work and denied employment without appropriate medical evaluation at saka yung counseling. Another policy statement, hepatitis B screening in the pre-employment setting should not be made mandatory. So yung screening for hepatitis B should be performed only if applying for occupations known to be at high risk for transmission of hepatitis B in the workplace. So sinasabi, it should not really be mandatory, as far as pag tayo, hindi siya, unless of course, yun nga, may high risk of transmission ng hepatitis B doon sa workplace kung saan sila nag-a-apply, And then, minimum requirements for a confirmed HBs antigen positive person, ito lang po. Pero it's already in the realm ng ating mga healthcare professionals, or specifically this policy statements for the physicians na. So, hepatitis B, we have to recognize na ang hepatitis B as a very real workplace issue. At it is considered, ulit-ulitin ko, a major public health problem here in the country at there's an increasing economic and social burden resulting from the hepatitis B infection. Tapos, in terms of advocacy, information, education, training, yung lack of awareness essentially affects our response to hepatitis B and is usually fueled by stigma towards the disease. So the stigma has a range of impacts, including yung preventing people from employment due to discrimination. Napakahalaga that proper information and education be provided for everyone in the workplace, no? Pwedeng sa magkaroon kayo ng mga education and awareness campaigns, no? Pwedeng mga as simple as mga health bulletins, may mga talks about hepatitis B, can have webinars ngayon. Natutunan na rin natin na kagaya nito, naka-webinar tayo, hindi na ganun kahirap na magkaroon ng information sharing, no? Kasi we now have the technology, no? And then of course, sabi ko nga sa inyo, parang kagaya rin namin, kahit even we are physicians, we can partner with health professionals, no? Mas alam nila, yung lalo na yung kung nandoon sa expertise nila, no? And then yung social policy, no? Yung non-discrimination, yung stigma, privacy and confidentiality, we have to stop the discrimination against people living with hepatitis B. Dapat wala sanang diskriminasyon sa mga taong may mga hepatitis B. Kung tutuusin nga, di ba? Pag-isipan natin mabuti. Kahit anong sakit sana, hindi ba dapat pag nagkakasakit nga, dapat tinutulungan natin, inaalalayan natin sila. Pero dito, nagkasakit na nga, i-discriminate pa natin, no? So basically, there should be in the workplace a non-discrimination policy. And of course, you can align it with this department or advisory. Tapos, wala rin dapat na biases in terms of hiring and even promotion, no? Tapos siguro, even dun sa mga training, no, yung sa leadership, no, and even sa compliance, dapat pare-pareho ang tingin, ano. So yung medical confidentiality, of course, meron din tayo, sabi ko kanina, no, yung tungkol sa Data Privacy Act. So of course, because of this, we have to really limit yung hepatitis B virus info disclosure at parang kung tutusin, yung need to know nang pwede lang makaalam, no. And then yung employment ng mga nagpa-positive sa HBs antigen workers, as long as they're medically fit, yung employment nila, yung working status nila as employees or workers should continue, no? Again, ulit-ulit, no? They should not be discriminated, but instead, they should be given the necessary assistance and accommodation. So, of course, yung fitness to work will be based on function. Yung doktor na titingin, no, it should evaluate yung job fit clinically and not simply by the hepatitis B status, no. Kaya nga 'di ba? Remember ito, matagal na itong department order at saka nung unang-unang panahon pa na alam na natin yung tinatawag na job modification, job accommodation na tinatawag, no? Then yung prevention and control measures, no. The prevention of the transmission ng hepatitis B or for that matter yung other infectious diseases. Yung prevention and transmission is the cornerstone of control of infectious diseases. So pag preventing yung transmission, it reduces, no, yung the disease burden and it reduces yung pool of carriers who can perpetuate in further transmission. So it also reduces the need, no, pagka na-control natin yung transmission, it also reduces the need for costly treatment of the infection as well as yung complication. So it can be as simple as, of course, it's a management call, no? Yung mga vaccination programs, yung mga free or subsidized vaccines for at-risk workers. You can integrate it sa pre-employment, sa annual screening. But of course, gaya ng records, no, even the vaccination record should be confidential as much as possible. Kasi kung yung mga hindi pa nabakunan, baka pag-isipan pa, hindi, ito pwede ito mahawa tapos eventually makahawa pa sila. So, ganun din. Basta anything about the medical aspect ng sa manggagawa, dapat yung confidentiality issue should also be taken into consideration. Yung mga standard precautions, no? As simple as yung use of PPEs, hand hygiene, yung paano mo i-handle ng sharps, no? How you to handle sharps safely. And of course, this has to apply to all, no? Regardless of hepatitis B status. Hindi lang yun dun sa may hepatitis, but across everyone. For all you know, baka ikaw pa ang carrier pala na hindi mo man lang alam, no? So it has to apply all those processes, all those preventive and control measures should apply to everyone. Then the companies must be ready to provide access to diagnostic and treatment services for its workers, no? So if if the company does not have the capacity, of course, doon sa mismong workplace, ang sinasabi naman, we can refer. Kahit kami mga doktor, pag minsan we also have and we also know our limitations. If necessary, we also refer to the specialist, no, or to those which we feel will be able to help us or help the worker doon sa tamang pamamaraan paano sila mapagaling. At pagkatapos nga, if we talk about kasi universal healthcare, no, ang isa meron tinatawag na individual-based health services. Ang isa importante doon kasi yung tinatawag na continuity of care. Kasi we also expect that when we refer patients to specialist, no, or outside our field of specialty, we expect that ibabalik sa amin ito at yung continuity of care noong pasyente na yon they happen to be worker in a company, for example, that a certain physician is handling, so natutuloy, nababantayan siya. Yun yung importansya ng tinatawag na continuity of care na kasama doon sa aspeto ng primary health care, no? And then ang workplace, no, there are different stakeholders, of course, no, in the workplace and even outside the workplace, no. Pero doon sa yung workplace response to hepatitis B, we have to acknowledge that it needs to be strengthened, no, and enhanced, no, to address again yung issue ng employment at saka yung workplace discrimination. And of course, to contribute doon sa prevention and control ng disease. So napakahalaga na lahat ng stakeholders should be on board. So to ensure that we will be able to combat itong sakit na to and hopefully reduce its burden, if not eliminate in the near future. No? You can, of course, integrate yung hepatitis B sa mga OSH policies or they can be standalone. But pero kung titingnan mo nga, kung ako kasi since there is a different pwede siyang standalone, pwede siyang incorporated. Pero ang pinakamahalaga, ma-embed lahat ng nakasulat dito. But of course, the different it's not just hepatitis B in the workplace. The other policies on those with health domains, pwede naman sila based doon sa existing policies and programs na meron. No? So we can include it sa mga manuals kung meron man kayo, health safety manuals. And of course, we should always update based on the DOLE or the DOH guidelines. No? So aside from that, kasama sa lahat ng stakeholders, kinakailangan supportive yung environment natin. Palalahanin natin, maaari lalo na sa mga nagkasakit dahil dun sa trabaho nila, you can establishment can provide yung mga employee assistance programs, yung mga peer support networks, no? And then of course, look into yung mga government and NGO collaboration, you know. You can partner with the specifically sa atin, ano, pag when we talk about this, of course, DOLE, no? And then of course, DOH also being this being a health problem, no? So understanding yung hepatitis B is very crucial, no, for maintaining a healthy workforce. And we have to ensure yung compliance with regards to legal requirements, no. Of course, us and everyone, no, we have vital roles, no, in the implementation of on the preventive measures and so in supporting affected employees, no. So lahat tayo may role, hindi yung iaatang mo lang bahala ka na. Ikaw doktor, bahala ka, ikaw nurse, bahala ka, ikaw HR, bahala ka na diyan. So lahat tayo may role, but at the end of the day, ang importante dito, we should have a very supportive environment and not something which is discriminatory na lalo lang pinanghihinaan yung ating mga manggagawa dahil nga sa mga pinagagagawa natin against them. So, hepatitis workplace policy will protect the workers' health, yung safety, and even their job security, no? So, again, employers must ensure yung education, vaccination access, and then yung prevent yung discrimination, no, on the part of the workers, and of course even the management, no. Yung workers and employees, everyone must follow yung hygiene at saka yung prevention measures, no. And then probably can learn for yung mga best practices, no, for an effective hepatitis program. Some of them siyempre yung some of them yung mga nabanggit na natin, no. But we can strengthen yung mga workplace policies by simply enforcing yung DOLE's guidelines, no. Yung mga sinasabi sa atin. Kasi nga kung tutuusin, ang DOLE nga nandyan siya para tulungan tayo for us to be compliant with what they are really putting out, no. Hindi naman para lang sa isa o dalawang tao itong ginagawa ng DOLE para sa atin. This is for everyone to ensure yung health and safety of the workers, not just sa hepatitis B but other concerns as well, no. Of course, yung regarding vaccination, best effort on the part of the of course, if necessary, may enforce siya dapat, no. Then can have mga programs on regular screenings, no. Can have as simple as program for a stigma-free environment, no, through awareness at saka yung mga education campaigns, no. So these are my references, no. Before I end, I would just like to share with you this thoughts from Abdul Kadir, no. Sabi niya, the root cause of stigma is ignorance, and its remedy is education. So in terms of hepatitis B, people need to know how the disease is transmitted and be assured that they will not be at risk during casual contact. So, my dear friends, we have to work together to ensure the dissemination of correct information regarding hepatitis B. We can start in our respective workplaces. Thank you very much.
Thank you very much, Doc Edmir, for the comprehensive and insightful discussion on hepatitis B. Kahit ako po ay maraming natutunan tungkol sa sakit na ito at sa importance ng proper education or awareness, screening and vaccination, healthcare access, at pagbibigay ng equal opportunities para sa mga taong may hepatitis B. At this point, we will start answering the questions submitted during today's presentation. Sa mga may pahabol pa po na katanungan, maaari niyo po itong itype sa ating comment section. For our first question po, Doc Edmir, meron po bang special diet ang member na may Hepa B infection?
Actually, it's more of ang dapat nating tingnan, no, ang may sakit siya, yung how to protect also the liver, no. So basically, it's yung mga maaaring makaapekto sa liver. So babawasan muna siya, no. So ganun lang siya. Wala naman siya talagang very very specific, very special diet. But again, it's just that pagka meron kang mga karamdaman na naapektuhan yung organ system, yun yung dapat na ating tingnan.
For our next question po, Doc Edmir, hindi ko po natapos ang gamutan ko. May third dose pa po ako, kaso po ay nawala ang record na bigay sa akin. Kailangan ko po ba umulit ng vaccine?
Actually, ang sinasabi mo ng mga ibang gastro specialists or hepatologists, no, kung may mga different school of thoughts, but basically ang importante dito kung nagdududa ka, pakuha mo yung titer ng iyong bakuna. Uh, pero even some ang sinasabi minsan hindi na kinakailangan daw ulitin eh. But of course it will depend on your attending gastroenterologist kung ano yung school of thought niya. But there are some na pagka minsan nga daw mababa, ituloy mo lang din. Pero of course, it will probably depend on the titer na meron ka.
Okay po, Doc. For our third question, recovered po ako from Hepa B. Pwede ba ako mag-donate ng dugo? Ilang years po bago ako makapag-donate?
Again, ang titingnan diyan yung ano mo, yung condition ng kaya may mga ini-examine ano. Kasi there are different phases ng hepatitis B, no. So even yung infective stage tinitingnan din 'yan, no. So again, may depende sa stage kung nasaang stage ka.
Okay, Doc. For our next question po, naging exposed po ako sa workmate ko na may Hepa B. Kailangan ko din po ba magpa-test kahit wala namang simptomas or ibang nararamdaman?
Okay. Gaya unang-una paano ka na-expose, no? Nasabi naman natin paano natatransmit ang hepatitis B. So that's one. Number two, yung sinasabi wala naman symptoms or ibang nararamdaman, gaya na nabanggit ko, even kung may chronic hepatitis, kung nagkataon may chronic hepatitis B ka, kadalasan wala nga simptomas eh. So, kung sa palagay mo nag-aalala ka, pwede mong ipatest, no? But if we talk about sa workplace, kung ano dapat sana may polisiya sila, ano ba? Hindi ba kanina nabanggit ko nga, no? Minsan ang gulo-gulo ng guidelines o di kaya wala naman kayong guidelines. So napaka-importante especially for work or establishment with maybe exposure prone procedure. Most likely alam ko sa mga healthcare facilities meron sila, no? But minsan you have to streamline yung mga guidelines ninyo. But yung wala kang nararamdaman o simptomas, pwede yon at hindi ibig sabihin wala kang sakit.
Okay po, Doc. For our fifth question, nalaman po ng employer ko na may hepatitis B po ako. They are asking me to resign. Ano po pwede kong gawin about it?
Sumbong ka sa dole.
Tama po, Doc. For our next question po, sixth question po natin. Sino po ang mag-shoulder ng labs and vaccine kapag ang employee ay na-expose sa blood or needle prick accidents sa workplace mismo?
Itong sagot ka maging ano ang tamang sagot dito kasi anong nakasulat sa policy ninyo. Kasi pwede ako magrekomenda, hindi yun yung polisiya ninyo, magkakagulo kayo eh. So ano ang isinulat ninyo? Ngayon kung wala kayo, dapat isulat 'yan. Kasi but of course for healthcare mga yung with exposure prone procedure, para sa akin dapat sagutin siya ng sagutin siya ng establishment eh.
Next question po natin. Included po ba sa konsulta package ang hepatitis screening?
Ah, Actually maraming mga bago ngayon, no? But the last time na nag-check ako, hindi ko siya makita, ano. But But probably you can kasi baka naman may mga updates, no. You can always ask na, no, yung sa konsulta package, no. Pero nung tiningnan ko, hindi ko sure, no. Mas mabuting ma-double check na lang.
Thank you po, Doc. For our next question, pwede po bang sagot na ng company ang bayad sa screening ng HEPA B, lalo na kung high risk ang employee dahil sa trabaho?
Kung ako ang empleyado, sasabihin ko, oo. Pwede naman. Kaya nga, parating ang, di ba, ang point ko parating, we enjoy the establishment. But at least, no, for high risk, no, for high risk naman, yung mga business persons naman, sana naman, unawain din, hindi naman hindi naman sila maaaring ma-transmit kung sakasakali kung hindi high risk, di ba? So, I think dapat sana. Dapat.
Okay po. For our final question po, Doc. Hello sir, question po. Kami po ay food manufacturing. If ever po na nagkaroon po kami ng positive HEPA B sa aming empleyado, i-continue po ba nila yung work nila sa processing or needed po nila maggamot muna? Concern lang po kami pag nasugat po sa loob ng processing line.
Okay, ganito, no? Unang-una, sabi ko kanina, there are different phases or stages ng HEPA B. Meron dyan na stage na, of course, may mga stages yan na infective, no. Ito bang worker na to, infective stage, anong stage siya? So yun muna ang unang dapat malaman muna yun, kasi minsan very 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 sweeping, no. Kaya nga ang parati natin sinasabi as far as HEPA B is concerned, these are healthy individual that can be gainfully employed that are being discriminated. Ito naman ngayon, siyempre dahil nag-positive siya, hindi naman ibig sabihin, unang-una, ano to, hindi naman siya, although of course I know there's a nil chance na pwede, lalo na kung sa manufacturing, may mga sharps, di ba? Pwede. Kaya lang alamin muna natin ano ba yung status niya. Kaya nga parating point natin, nakarinig ka ng may hepatitis B na di-discriminate na kaagad sila. For all we know, employable pa rin siya. Tsaka 'di ba sabi nga natin yung risk, no? Ano yung category 1? Yung healthcare workers with exposure prone procedure. Now, kung may exposure prone procedures yan, yun ang recommendation ko. Check niyo yung status niya, hepatitis B status niya.
Okay po, Doc. Doc, may ipahabol lang po na question po. Hepatitis test is not mandatory. So why some employer daw po is requiring this test?
Actually, dapat sila ang tanungin natin, ba't mo nire-require? Para saan yan, di ba? Minsan, ano yan, red flag nga yan eh. Bakit mo ipapatest yan? Ngayon, ako sa akin, kung ililibre yan ng employer, why not, di ba? Kaya lang, even if it's free, it should not be a reason to discriminate an employee. Whether it's for pre-employment or for the annual medical exam. It should not be a reason ma-discriminate, ma-terminate ka, or even for promotion should not be used.
Thank you po sa pagsagot, Doc Edmir. So maraming salamat po sa lahat na nag-submit ng questions. Kung mayroon po kaming hindi nasagot ngayon, rest assured po na ang aming social media team ay sasagutin ang inyong inquiries mamaya. Once again, thank you very much po, Doc Edmir Kabulos, for sharing your expertise on our topic for today. Mayroon po ba kayong final words or thoughts na gustong iwan sa ating mga Facebook Live viewers?
Actually, yun ang sinasabi natin, ano. Panating pag may ginawa tayo, panating mong sabihin, para saan? Ngayon, in terms of this, parating ito yung sinasabi ko, bakit nagkakaroon ng discrimination? Minsan sa kakulangan ng kaalaman. We can reduce yung discrimination, yung stigma, pag nabigyan tayo ng tamang impormasyon. Yung tamang impormasyon na yun na magsasabi, like in the case of hepatitis B, kung nakakahawa ba talaga ang tao, hindi. Di ba sabi nga, napakaliit, depende sa, of course, sa establishment or nature ng work, ang possibility ng transmission. Pero siguro makukorek lahat ng misconceptions natin if there will always be the proper way of educating and training ang ating mga manggagawa. Yun ang pinakamahalaga. Kasi yung kakulangan ng kaalaman, yun yung nakakasama. So dapat ituro natin yung tamang impormasyon.
Maraming salamat po, Doc Edmir. On behalf po ng Bureau of Working Conditions, we thank you po for being with us today and sharing your expertise on hepatitis B. And before I officially close today's webinar, here are a few announcements. The next episode of the Webinar Wednesdays will be held on August 6, 2025 with the topic Workplace Technical Safety, Electrical Wirings. If you have further questions, you may send us an email at us@bwc.dole.gov.ph or you may call the Dole Hotline 1349. Also, please follow our official Facebook page, Viber, YouTube, and X, formerly Twitter, and Dole BWC 1949 para maging updated kayo sa iba't ibang issuances, announcements, and activities na inilalabas ng BWC at ng Dole. And that concludes our webinar for today. I believe that it has been a very productive day dahil napakarami po nating natutunan sa ating speaker. Again, thank you for joining us today and we look forward to seeing you in the next episode. Ingat po and God bless us all. I am Jan Barbosa, your host, now signing off.
Para sa mga katanungan at karagdagang impormasyon, maaari po tayong tumawag sa Dole Hotline 1349 o sumuli sa mga Dole Regional Field Office na nakakasakop sa inyong lugar paggawa.